Good morning, everyone. This is Annie Scully. Thank you for logging in for our Get Connected with United Way of Connecticut 2-on-1 webinar. This is the first webinar of our 2018 summer webinar series, and there will be 6 other webinars throughout the summer. So if you haven't had a chance already, please make sure you check out our outreach page on our 2-on-1 website, which I'll make sure to show you guys during this presentation. And it will give you the opportunity to sign up for the 6 additional webinars that are going to be offered throughout the summer. Today's webinar is going to focus on United Way of Connecticut 2-on-1, which is our 24/7 information referral service here in Connecticut. It will also provide a quick demo of our 2-on-1 website, and I'll also show you some new features and some features that are coming soon. As a little bit of a housekeeping, you guys will not have the opportunity to speak during this webinar. You're in listen-only mode, but I'll make sure that I open up for questions and answers at the end. So please bear with me. If you guys have any comments throughout the webinar, please feel free to chat, and I'll do my best to answer during the webinar. But if not, I'll make sure that I address all of your questions at the end. Thanks so much, and let's get started. So what is 2-on-1? 2-on-1 is a free, confidential information referral service that connects people to the essential health and human services 24 hours a day, 7 days a week, either online or over the phone. As you can see from the map, 2-on-1 covers almost our entire country. Almost 94% of the country has coverage by 2-on-1, meaning that they can call that 3-digit dialing code and be connected to resources within their community. There are more than 200 independently operated 2-on-1s throughout the United States, and many, like ours in Connecticut, is operated by United Way. We're accredited here by AIRS, which is the Alliance for Information and Referral Services, and began as InfoLine in 1976 as a public-private partnership between United Ways and the state of Connecticut. In 1999, we became the first state to use a 2-on-1 statewide. So just to give you a little bit of an idea or paint a picture as to how much help we provide or how much volume we have on our website and via our call center each year, in FY18, which was just this past fiscal year, we handled more than 250,000 calls from Connecticut residents. And each of those calls resulted in more than 320,000 service requests. So to give you an idea of what that means, each time one of our contact specialists handles a call, it might result in several service requests. If someone's calling about housing, they might also realize that they want to have a connection to the food resource in their community, or they're looking for employment help, or they have questions about utilities and how to afford their housing. So each individual transaction, which is a call, can result in multiple requests for service. As you can see from the chart, housing and shelter is by far our #1 service request, or the #1 need that Connecticut residents have or had in FY 2018. Closely behind is our mental health services, employment and income, crisis and intervention services, and then healthcare. The bar chart to the right shows you our website volume and our website traffic. And as you can see, that traffic has been increasing substantially throughout the past few years. In FY18, we had nearly 2 million visits to our website, and I'm excited to be able to give you guys a quick demo of that website later on in the presentation. So in addition to 2-on-1, United Way of Connecticut offers several other specialized services. Some of you might be familiar with these. If not, I'm happy to give you some more information about them. Either you can email me directly and I can put you in contact with individuals that direct these programs, or feel free to ask questions at the end of the presentation. But United Way of Connecticut offers our 2-on-1 child care program, which helps families find child care programs that meet their needs. The state's Care for Kids program, which is our child care subsidy program for low-income working families. The Child Development Info Line, which connects parents to services for children with suspected or diagnosed developmental delays, and also serves as the essential intake for birth-to-free services. Our Youth Mobile Crisis Intervention Services, formerly known as EMPS, which is Crisis Intervention for Youth. This is available 24/7, 365, just like our 2-on-1 dialing code. 2-on-1 Housing, which is provides coordinated access to housing and emergency shelter in Connecticut. 2-on-1 is actually the state's central intake for our coordinated access network. So it helps people transition into housing as quickly as possible. So if anyone in the state is homeless or imminently homeless, they should call 2-on-1 right away to start the process of finding temporary and then permanent housing. We also offer our 2-on-1 Navigator, which screens for 23 federal and state assistance programs. And finally, our opiate enhanced information referral system, which is a new program here at 211 that helps connect callers to substance abuse disorder information, education, and treatment options. So now I'm going to go ahead and we're going to start our live demo. And I'm hoping that many of you are familiar with this homepage, but when you type in www.211ct.org, you'll be brought to our 211ct.org homepage. At the top, you'll see these two little bars, which give you right away some of the most important or timely information that might be going on. So right now, we're advertising our 211 Connecticut free summer webinar series, which many of you have already taken advantage of, but also information about recent natural disasters. So you can click on either of these tabs to bring you to that most pertinent information. I'm going to go ahead and dismiss those for right now. But at the top of the page, you'll see About 211, Get Help, Professionals, e-Library, and then an opportunity to log in or sign up for our new My 211 account. There's also this tiny globe in the top that I always forget to show, so I'm going to do it right now. But it allows you to translate our website completely into 23 different languages. So if I go ahead and click Spanish, the entire homepage and every search that I run off of this homepage is now translated into Spanish. So if you speak Chinese, So if you speak Chinese, or if you're working with a client that speaks Chinese, that's a great option to be able to make sure that you're working in a language that you're most comfortable with. If you did that by accident, like I do all the time, you can go ahead and click Show Original, and it will automatically bring you back to English, which is the default setting for this website. If we scroll towards the bottom of the page, you'll see there's some links for some of our specialized services that we talked about earlier. So right here is the Child Development Info Line, our Child Care Search, our EMPS service, and then this is a link for our community calendar. Our community calendar publishes events that are free and open to the public, and the only requirement is that they're offered by a program or an agency that is active within our database. We have a database of more than 40,000 programs and services that offers programs from more than 4,000 agencies. We have a team of 5 full-time resource specialists that work to maintain that database. So any agency that's offering a program can also make us aware of some special events that they're offering throughout the state. Once you get to the community events calendar, you can go ahead and you can type in a specific date or a keyword, or you can also choose these filter options. So you can filter by different types of events. You can filter by day or by location. So if you're looking for events that are offered in Bloomfield or Brantford or Danbury, you can go ahead and click on that specific town or city, and it will filter the calendar to only show events that are being offered. If you're interested in submitting a calendar event, you can go ahead and click this tab right here at the top of the page, and it'll give you some quick instructions as to how to do so and provide a simple online entry form. Click the bottom, and it will be screened by our information referral department, and events that are appropriate to be added to the calendar will be reflected. All the way at the bottom of our homepage, you'll see this tab for 211 Navigator, and that's our online benefit screener that screens for 23 programs and services. Here's a quick list of those programs, and if you're interested in a little more information, if you click on one, it will give you a quick description and then a link for any application that's available online. The application itself, or I should say the screener itself, it doesn't determine eligibility, but it will give you a pretty good idea of the programs and services you might be eligible for. It asks you some pretty basic information about where you live, how old you are, some family details, some minimal income details, and then asks you to submit that information, and it will generate a list of all the programs that you might be eligible for. So if we go back to our home page, we're going to scroll up to the top, and you'll see this tab for professionals. So this page is geared towards providers and agencies and professionals within the community that might want information about, publications and reports that 211 offers. We have a community connection newsletter that goes out every month, as well as a new publication known as our CT Data Glance. So both of these publications you can sign up for right here on this website, or also click on these tabs to view past publications. We also have a link here for our 211 data dashboard called 211 Counts, which will feature in a webinar later this summer and go into a little more detail. But just to give you a quick sneak peek, this online data dashboard provides a quick picture of the service requests that we receive from individuals across the state. You'll see at the left side of the screen, there's top needs bar charts, which can be filtered even further by specific subcategories. You can also choose to filter the information on the screen by location. So if you're only interested in a certain zip code, a county, a congressional district, and so on, you can set the information and filter it to show just information from that region. In addition, you can choose a custom date range or a preset date range. When you visit 211counts.org, it automatically shows information for the entire state of Connecticut for the last 365 days. But if you're working within a certain time frame or you're looking at a certain region, you can filter that data so it'll only reflect data from that location and that time. Once again, this information reflects only our call data. So every time a 211 contact specialist gets a call, the data from that call will be reflected on this dashboard. If you scroll down a little bit, you'll see there's also a map which provides some census data in addition to our call data. So if you hover over a certain town or city, it will give you information about the number of requests we receive, but also the percentage of poverty, the unemployment rate, percentage of people that have less than a high school diploma, and the percentage of people that are renting as opposed to buying their homes. So we are going to go back to 211ct.org. And now I'm going to get into the fun part, which is our advanced search and filter features within our website. There are 3 basic ways to search on our 211ct.org website that I'm going to show you right now. And the first is just by keyword or program name. So if you see this search box at the top of the screen that says, how can we help you? I'm looking for, you can go ahead and you can type a keyword or the name of a program or the name of an agency right into that search box, and it will populate results for you. If you're not really sure of the name of the program or looking for more general information, you can start by simply typing something as basic as food, and you'll see that it will come up with suggested search terms for you. So by typing food, I realized maybe I'm looking just at food pantries. We also ask that you provide a location. The more specific you are with your location, the better the results will be once you click search. So United Way of Connecticut is located in Rocky Hill, so I'm going to go ahead and keep Rocky Hill there and click search. So we'll see here that there's 34 resources that serve people interested in finding food pantries that are located in Rocky Hill. If you scroll down, you can see some additional information about each one of these resources. It will give you the agency that offers it, the location, which you can click on, how far away it is, and a quick description about what the actual program is. If you're interested in more details, you can click on that tab, and it will give you some eligibility information, a phone number, hours of operation, and then some more information about the actual agency that offers this program. If we go back to results, we can also see that to the right, you can scroll through these resources using the pinpoints on the map. So one great feature about our website is that it's totally mobile friendly. So if I was on my cell phone right now and realized, hey, I do want to check out this food pantry located at 371 Wolcott Hill Road, I could go ahead and click that call button or the phone number, and it would automatically start calling right from my cell phone. We also have a built-in Google navigation or Google Map directions through this website or through our website. It's totally Google friendly. So if you click Get Directions, it will allow you to choose how, it will give you directions to that program location and also allow you to choose how you're going to get there. So if you think you want to try to walk or ride your bike or take public transportation because you have some kind of a transportation barrier, Google Maps will provide you the best way to get to that location using the method of transportation that's available to you. So that's using our keyword, our program name search option. The second way to search on the website is through our help statements. There's a number of pre-populated help statements that are based on actual conversations that our contact specialists have with people that call for help. When people call, how do they actually ask for help? They say, I need a place to stay tonight. I need food. I need help finding a job. I need counseling services. So you can click on any one of these statements, click continue. Once again, it will ask you for a location, and it will draw you right back into our database. So once again, it will provide you with a list of programs that are going to help you find help for I need a job in Rocky Hill, or serving Rocky Hill, I should say. Each one of these individual resource cards you can print or share, or you can add to a list. And I'll get into a little more detail about that feature after I show you our third search option on the website. So the third option is by category. So you'll see there's some basic categories listed under our Let Us Help You statements. But if you click more categories, it will give you a bigger picture of some of the basic categories we offer here. This is not an all-inclusive category search of our 2-in-1 database. As I said earlier, we offer more than 40,000 programs and services, but this is a pretty good snapshot of the various resources that you can access by dialing 2-in-1 or visiting 2in1ct.org. So if I click on food, it will give me some links back into our database. So either emergency food, meals, and this suggested reading category will bring you to our e-library, which is about 450 white papers that our information department maintains regularly. Like I said, each of our resources is updated at least once per calendar year, and that's the same for our e-library papers. So these are quick, just the facts papers to give you a quick snapshot of on various programs or timely events within the community or within the state. So just stick with our example of food pantries. If I click food pantries under emergency food, we'll once again be drawn into our database. So right now it's populating for the entire state of Connecticut, and as you see, that's kind of an overwhelming list. So I'm going to go ahead and I'm going to choose Rocky Hill and click search. So now that I've filtered that list from more than 300 resources down to 30, I want to click that advanced search filters feature, and I can hone that list in even closer to really fit the need that I'm looking for. So if I know that I can only attend or only make it to a food pantry on a Tuesday or Wednesday, if you were looking for housing or some sort of a sober home or support group, this gender and age category might be applicable. But for right now, food pantries, day of the week is probably the only filter we're going to need to use. So because I can only go on a Tuesday or Wednesday, I'm going to filter those results. And we'll see that list of 30 resources dropped down to about 18 resources. So now that I have a pretty good list of food pantries that I might be able to access on a Tuesday or a Thursday, I'm going to go ahead and I'm going to start adding those to my list. And you'll see when I do that, it allows us to start populating our resource list. So we can go ahead, and this is where I'm going to talk to you a little bit about a new feature we have called My 2-in-1 Account that you can access through the homepage. But because I've already created an account, it will allow me to add something right to one of my lists. So I'm going to create a new list for this situation because I'm looking at Rocky Hill food pantries. I'm going to create a list, and then I can go ahead and start adding each individual resource to that list. So if I click this, I can go select the list and click Rocky Hill food pantries, add to list. So if we go back to the home page, you'll see that I was able to do that because I've created a My 2-in-1 account. My 2-in-1 account is a new feature that we began offering at the beginning of the summer. And it provides an opportunity for individuals to create custom resource lists that can be saved and shared. It also allows providers to make custom care plans that can help to serve the clients they work with closely. And you can go ahead and you can access these lists as often as possible, and they can be updated as needed. You can also print lists and just in a user-friendly format, or email or text a list directly to the person that you're working with. So if I chose to sign up for a list, you'll see that for a My 2-in-1 account, you'll see that this entry form is fairly straightforward. The only thing we require is that you provide an email and a password. The other information, such as your name, your last name, your organization, and your phone number, are all completely optional. So just by providing your email and a password, you can start creating these custom resource lists. Because I already have an account, I'm going to go back and log in. And I'll go ahead and I'll show you my current list of resource lists. You'll see here that the Rocky Hill food pantries list that we just created is right at the top. And that's because I have my list sorted by date created as opposed to name. If I did it alphabetically, you'll see that Annie Scully's care plan is the #1 list there. So within each one of these lists, or with each one of these lists, you can rename at any time, or you can also choose to share this list. So say that I wanted to email this to myself. I would go ahead and select my email, and I could say, it's from Annie Scully, and write a quick list and say, hey, Annie, here is your list of resources. And go ahead and click send email. You could also choose to text that email. If you go back to share list, you'll see that you have the option to type in a phone number and send that as a text message. And someone that gets that will get a link where they can click on it and they'll see this entire list of resources that you've created. So some of you might remember our cart feature that we used to have. This My List or My 2-in-1 account is our new and improved version of the 2-in-1 resource cart. So now I'm going to show you, and this is some features that are coming soon. They haven't been released yet, so this is a little bit of a sneak peek for you guys. But I'm going to show you our multi-term search feature and our 2-in-1 community comment feature. So once again, I've already logged into my 2-in-1 account, and I can tell that because it doesn't give me the option to log in. It just says my 2-in-1 account. So I can go ahead and I can click on that, and it will show my list of resources. So I already created a list of resources for addiction and for food in Rocky Hill. So let's say that I want to open this Rocky Hill list, which I've added no resources to, and I want to start a new search and find resources. So I can go back to our home page and once again type in food and click food pantries and search. So this new multi-term search feature will allow me to search more than one taxonomy term, which is food pantries, or category term at a time. So if I click search multiple services, I can type in food, and it will automatically provide a list of suggested search terms that have to do with food. So in addition to food pantries, I want to do commodity supplemental food programs. Maybe I want to do food voucher. Another thing I might be interested in if I'm looking for all the food resources in Rocky Hill are farmers markets. Maybe I want to look for school lunches or our SNAP program, so I can do school lunches. So I can add as many additional search terms to this search as I'm interested in. And then once again, you click the search button in the right-hand corner. And now my list of food pantries will also include all of these additional terms that I've chosen to search. So each one of these resource cards, once again, will provide you with a quick snapshot of the program, and you can also choose to click more details to get more information, but it now includes these additional search terms. Our second new feature is called our 2-in-1 community comment feature. So some of you providers on the line might be familiar with the way that you can update resources through our 2-in-1 website. By clicking more details and selecting update this listing, you can go to suggest and edit. And this will bring you to a entry form or an update form that I'm sure many of you are very familiar with that allows you to provide your name, your email, and your phone. It automatically populates the agency and program name that you're trying to update, and then asks you to provide a quick description of your update. This form is then sent to our information department, and they screen it to make sure that the information is accurate. They verify it. They might reach out to you directly or reach out to that program or agency directly before they make the change on our website. Our new community comment feature allows you to provide a community comment about a listing that isn't screened by our info department prior to being populated on our website. So once again, if I go to update listing, instead of suggest and edit, I can go to submit a note. So let's say that I work for John Driscoll United Labor Agency's commodity supplemental food program. And I see here that it says that the eligibility is age 60 plus. But I realize that we've just changed our eligibility requirements. So now you can be 55 plus to attend this program or to use this resource. I can go ahead and I can make a change there that says new eligibility is 55 plus. And click submit note. So by doing that, this note will be automatically published on our website. It will be very clear that it's from a user, and it has not been reviewed or verified by 211 Connecticut. And it will remain active on our website for 7 days unless our 211 information and referral department decides to remove that note prior. Notes submitted by users will be forwarded directly to our resource team for review and verification, but will remain immediately visible on the website for all users to view. In order to provide a note or a community comment, you have to have a My211 account, but anyone can see these notes. So even if I don't have an account, I can see that note. And so this feature is really intended to allow the community to provide feedback about resources. So if you show up for a food pantry that's supposed to be open on a Tuesday at 3:30 and you get there at 2 o'clock and they're closed, leaving a community comment might be a great way to allow others to know that that resource wasn't open, and to let our 211 CT.org information department know that we should maybe verify the hours for that resource. If you're someone that works for the agency and there's some sort of a power outage or an emergency where that resource won't be open when they're supposed to be, that's another great way to use the community comment to allow that information to be published immediately on our website. So thanks so much for logging in today. Before we finish up, I just want to run through a couple quick items about how to get the most out of 211. So please refer individuals you serve to 211. It's a great idea to create a My211 account to start building, saving, and sharing custom resource lists. You should always sign up for our community connection and our data glance to get timely information about what's going on in your community, as well as a snapshot of our database. Our data glance provides a list of recently added resources to our database every month to give you an idea of what's new. You can also remember to add and update programs listings in the 211 database via our professionals page. You can always order free 211 materials through our professionals page. Visit our 211 Counts online data dashboard to get an idea of the most pressing needs in your community, and share 211 promotional videos to raise awareness. We're excited and grateful to be the first place that Connecticut residents turn to for help in Connecticut. So we really want to make sure people know that we're a resource that's available 24 hours a day, 7 days a week, either online or over the phone. And our mission really is to help meet the needs of Connecticut and its residents by providing information, education, and connection services. So all of you community providers or all of you residents on the phone today that help to make our resource as powerful and as expansive as possible, thank you so much for all you do and for your support. And once again, thanks for logging in. Right now, I'd like to open it up to questions. So if you have your chat box opened or your Q&A box open, please feel free to chime in and ask me some questions. I'll make sure to follow up with everyone on this webinar with a copy of this presentation, as well as some additional information about upcoming webinars. So thanks so much. If you look at the top of your screen, you'll see there's a Q&A box where you can ask a question. You can also choose the comment or the chat section, I should say, to ask questions. I just had one question about, would you send me a copy of the presentation? Absolutely. I'll make sure that I follow up with everyone that's on this webinar with a copy of this presentation, which will have some live links as well as some basic information about 211. There was one question about the vetting process for people who need food assistance. And that would be a great tool to use for that. Could be our 211 Navigator, which will allow that individual to know if they qualify for SNAP or for WIC or for resources like that. As far as food pantries, some food pantries have individual criteria. Some allow anyone in the community to come. Some ask for some income eligibility information. So that really varies by food pantry. Our 211 contact specialists, when they receive phone calls, will ask questions about income eligibility for resources that always have a set threshold for that. But as far as a food pantry, they would just provide referrals to that individual food pantry. And once again, this webinar is being recorded, so it will be available on our outreach page on the 211ct.org website. That page, many of you access to sign up for this webinar. And as a quick reminder, we have 6 more webinars being offered this summer. Our next webinar is going to be on Thursday, August 2nd from 10 to 10:30, and it will be on food resources in Connecticut. And our very own Kate Quigley will be conducting that webinar. So it's one that you don't want to miss. Well, thanks again, everybody. I appreciate you taking time out of your morning. And I'm once again excited to be able to share some of our up-and-coming features on the 211 website. I hope you enjoyed the presentation and look forward to connecting with you guys soon. Thanks so much and have a great day.